Patrick. So I told you in the process, the agenda, what we're going to do is Medicare 101.
Right.
So before we even make a decision on which option you're going to choose, we're going to do a little bit of a Medicare education.
Okay.
Okay? So you've received this red, white, and blue card.
Yes,
It's your
I do.
Medicare card.
Right.
It has Part A and Part B. And you'll see here that on the dates of your card, it says May 1.
Right.
Okay? So your plan's going to start in a couple of days.
Right.
So we've got to make some options. We've got to decide what to do with it.
Mm-hmm.
A lot of people think that Medicare, that card covers everything, and it doesn't. There are some gaps in there that we've got to fill.
I always wondered about that.
Yeah, a lot of people think they can just run with just their Medicare, and that's not a good thing. Okay? All right. So, Part A. Part A, you're entitled to Part A because you've worked 10 years or 40 quarters. So people that have met that requirement pay no premium for that benefit.
Okay.
Now, Part B, there is a premium. Majority of people will pay a premium in the range of about $135.50 for their Part B.
I did get a letter from Social Security stating that.
So you're going to have to pay that. They're going to take that out of your Social Security check.
Okay.
Okay, now, I get asked, some people pay a lot more, and that's because it's based on their income.
Okay.
Now, there's people that say, well, my friend over here doesn't pay anything. Well, there are some people that don't pay a premium for that, and those are people that are enrolled in Medicaid. They're very low income. They've qualified for their state Medicaid program, and the state is paying that premium for them.
That's why I thought it covered everything, because my neighbor has that.
So,
And he says he doesn't pay nothing, that I
Yeah.
should get that. Huh.
but you've
Interesting.
obviously planned for your retirement. You've got some assets and some retirement income. You're not going to qualify.
He's broke.
So those are the type of people that qualify for
Okay.
Medicaid. In your scenario, you're going to pay that $135 a month.
Okay.
Okay. Now, so just that card alone, Part A helps pay for your hospital stay and inpatient care. There is a deductible of $1,364. So there's a hole there that you got to fill. Part B helps pay for your doctor visits and all of your outpatient care. There's also a deductible there. That for this year it's $185, and after you've met that deductible, you're responsible for 20% of the cost.
Okay.
Okay, and there's no cap on it, so it's a little scary. Also, the scary thing about just running with this card alone, you have no prescription benefits.
Wow. Nope. I need my meds.
So we got to figure something out.
Right.
Okay, all right, so here are the solutions. We have two options. Okay, option number one, and this is not because it's better or worse. I use this, I tell people, it's like choosing a car or a truck. Is a car better or a truck better? Well, it depends. It really depends on you. So there's not one plan that fits everybody. So option number one, this is a Medicare supplement paired with a prescription drug plan. Okay, so it's a package that we're going to put together for you. Okay. Option number two is a Medicare Advantage plan that includes the prescription benefit built in.
Okay.
So there's pros and cons to both. So I'm just going to give you some generalities, and then
Okay.
we can dive into it a little further.
Okay.
But I need for you to tell me which way we're going to go.
Okay.
So on option one, a Medicare supplement. Okay, the supplement fills the gap that you have here on your Part A and your Part B. It will pay your Part B, your Part A deductible, depending on your plan that you choose. Right now, the most competitive plan is Plan G, but there is a Plan F and there's a Plan N that are very, very competitive in price. Most people are going with the G. The G does not pay the $185, the Part B deductible, but it will pick up the 20%.
Okay.
So if you end up going that route, your only obligation is at $185 annual deductible.
Okay.
Okay, that's the big plus. So you'll know that in a given year, no matter what happens, your worst case scenario is you're only out $185. If you choose the Plan G. There is a Plan F that will cover that for you, but it has a different premium cost, and we'll discuss that later.
You know, my friend did tell me to ask you about Plan F.
Okay, so F is going away next year. In 2020, we're not going to be able to sell Plan F. It's all moving to Plan G. So I'll discuss that with you if that's the route that you decide.
Okay.
Now, so G is going to take care of these obligations. The $1,364 deductible, it's going to take care of the 20% for your Part B. You're going to be responsible for the $185.
That deductible, is that an annual deductible or a monthly deductible?
This $185 is an annual deductible.
So I just pay it once?
One time.
Okay.
For the whole year, and you're done.
Okay.
Okay? Now, we're going to pair that with a prescription drug plan.
Okay.
Okay? Now, those are the positives of the plan. The only negatives to the plan is the premium.
Okay.
Approximately every area, male, female, there's going to be different rates,
Okay.
but we're going to project it's about a $200 a month premium for this package together per month.
Okay.
Okay, so you'll pay $200 monthly for that premium.
Okay.
Okay, that's the only negative on that side. Now,
Is that including my Part B premium?
No, you have to pay the $200 plus your $135.50.
Holy smokes, Luis.
Okay. Now, here's another positive to this side. There's no network. So you go to any doctor, any specialist, any hospital that accepts Medicare. So a lot of people that travel, or if you have a lot of doctors that you see and you don't want to have to worry about whether they're in network or out of network, Medicare supplements are very advantageous. Now, we're not going to spend a lot of time on a prescription drug plan because the prescription drug plan here and then just the prescription drug plan over here function the same way.
Okay.
They have the same mechanics, so really the prescription drug plan is not a factor. We're going to take that out of the equation. It's just going to be the Medicare supplement or the package on this side, on option 2.
Okay, but you said that this doesn't cover prescriptions.
Right, so when we package this together,
Uh-huh.
we're going to do one package for your Medicare supplement,
Okay.
or one plan for your supplement, and then we're going to pair it with a prescription drug plan.
So do you need a list of all my medications?
Yes, we're going to get that.
Okay.
We're going to get to that towards the end.
Okay.
Okay, it's going to be real important in helping me decide which companies are going to be best for you.
Okay.
Okay? On option 2, this is a Medicare Advantage plan. Now, the biggest positive to this plan is that there is normally no premium if you decide to go with an HMO, and it's a minimal premium if you decide to go with a PPO. Okay, but that's the positive on this Medicare Advantage side. Okay, there are some perceived negatives. One of the perceived negatives is that you have to stay in network. Well, if you get an HMO, yes, you have to stay in network unless it's an emergency. If you choose a PPO, you'll have some out-of-network benefits, but it's going to cost you more to use those out-of-network benefits.
Is that what happened to my friend?
That's what happened to your friend. You went to a clinic and it wasn't in network. And he probably had an HMO, so they said they don't take that plan.
Gotcha.
Your other friend may have had one of two options. He may have had a supplement, and
Well-
because that clinic takes Medicare, he was good to go.
He had Plan F. He
So-
told me
so
to
he-
ask your agent about Plan F.
So he had a supplement. So that was the difference. So you have to be very aware on this side of your network.
Oh, hell.
Okay, all right. So, but on this side, your deductibles that you have to pay, your $185 deductible for your Part B, your $1,364 for your Part A, those go away. What happens over here on your Medicare Advantage plan is you're going to have co-pays and co-insurance for your benefits. You're going to pay as you use them.
Okay.
Remember, you have no premium if you choose an HMO. There are some PPOs that are as low as no premium. There are some PPOs that cost $15, and there are some that will cost about $80-something. These prices vary depending in the area that you're in, but that gives you an approximation of how much the PPOs cost.
Okay, so help me understand this and tell me if I understood it right. If I go with option 1, which is a Medicare supplement, and I go with Plan G, I just pay my Part B deductible.
Correct, which is
And
$185.
pretty much after that, I could go to any doctor that takes Medicare,
Correct.
and I don't pay nothing.
You're done.
So I could be in Florida, New York, California. I'm not locked into a certain network.
Correct.
Okay. If I go here under option 2, then I just pay as I go.
Correct.
I'll have a low monthly premium, but I'll just pay to see doctors, specialists, hospitals, any medical services that I need.
Correct.
Okay.
Correct. So there's not a one.
Now I understand.
There's not a one plan fits all type of program out there.
Right.
In fact, these are your only two options. You can run, when I say run naked, which is not a good thing, with just going with Medicare only.
Right.
You can go option 1,
Okay.
an Advantage plan
Okay.
with a prescription drug plan, or you can choose a Medicare Advantage plan
Okay.
that includes prescriptions.
Well, Luis, thank you for explaining it to me. People confuse the hell out of me out there.
Okay?
And this is not as hard as it seems. It's just picking the right one.
It's picking the right one. A lot of people get confused. They're afraid to make a decision. They're afraid to choose the wrong plan.
Yeah.
So when it's broken down like this, I still have some more work to do.
Yeah.
Okay, but I need for you to tell me, I'd like to go this route or this route.
Well, I'm going to go with the Medicare supplement
Okay?
because I'm going to travel a lot.
Great.
And I don't want to have that headache of finding doctors, places, providers to go to.
Great.
I
great.
just want to be able to go
I understand. Great.
and everything paid in full.
Awesome. We'll discuss that. So let's get
Okay.
into option 1. On option 1, I'm gonna cover one more thing here that's important about Medicare 101.
Okay.
Okay. First of all, right now, as I'm enrolling you into these plans, we're going to use the initial election period.
Okay.
What that is, these are people that are turning 65.
Uh-huh.
I have a 7-month window. 3 months before you turn 65, the month that you turn 65, and 3 months after.
Okay.
We're going to use this period, this election, to enroll you in this plan.
Okay.
Okay. We're also going to use the Medicare Supplement Open Enrollment. What this is a 6-month window from the time that you turn 65.
Okay.
Pretty much all it is doing is giving you a guaranteed issue policy. It doesn't matter what your pre-existing conditions are. In fact, we're going to bypass all the health questions. We're just going to get guaranteed issue, and you're automatically going to get the policy that you want.
Okay.
Okay?
Nice. So it doesn't matter what my medical condition is, unlike life insurance where they have to underwrite you.
Not right now. If you were to decide to make a decision after the 6 months that you turn 65, and you want to switch Medicare supplement plans, they're going to ask you the health conditions, and you might not qualify.
Okay.
Depends on your conditions.
Right.
But right now it doesn't matter.
Oh, how?
We're in open enrollment.
Then we got to do it now.
Gotcha. Well, sounds good. Well, let's get into the Medicare supplement and the prescription drug plan.
Okay.